Today we'll discuss about the cleaning and shaping of the root canal system. So what does cleaning and shaping means? It is to remove all the contents from the root canal which may cause growth of the microorganisms or breakdown of toxic products into the periradicular tissues. So, to prepare the root canal not only for the disinfection but also develops a shape that permits the three-dimensional sealing of the canal. So, for success of the endodontic treatment, one must remove all the contents of the root canal completely because any communication from the root canal system to the periodontal space acts as a portal of exit, which may lead to the formation of lesions of the endodontic origin. So, coming to the objectives of the biomechanical preparation. So, we have 5 mechanical objectives that was given by the Schilder. First one is that the root canal preparation should develop a continuously tapering cone, which is like a funnel shaped preparation of the canal which merges with the access cavity, thus forming a continuous channel. Next is the making the preparation in multiple planes, which introduces the concept of the flow. So this objective preserves the natural curve of the canal. And next is the making the canal narrower apically and wider coronally. So to create a continuous taper up to the apical third, which creates the resistance form to hold the catapercha in the canal. And the later one is to avoid the transportation of the foramen. So, there should be a gentle and minute enlargement of the foramen while maintaining its position. And the final mechanical objective is to keep the apical opening as small as possible. Now we will discuss the biological objectives of the root canal preparation. And this procedure should be confined to the root canal space, and all the infected pulp tissue, bacteria and their byproducts should be removed from the root canal. And the necrotic debris should not be forced periapically, and there should be a sufficient space for the intracanal medicaments and irrigants should be created. Now we'll see the different movements of the instruments during the cleaning and shaping position. So, in that, the first one is the reaming motion. Here, it involves the clockwise rotation of the instrument. And that means it is to use the sharp edge of the tool for enlarging the holes. So, next we'll see the filing motion. This indicates the push and pull motion with the instrument. Here, the instrument is placed into the canal at the desired length and the pressure is exerted against the canal wall. And the rake of the flute rasps the walls as the instrument is withdrawn without turning and the pressure is maintained throughout the procedure. Next is the combination of the reaming and filing. In this technique, the file is inserted with a quarter turn clockwise and apically directed pressure, that is the reaming, and then is subsequently withdrawn with an action of the filing. So, here the file edges gets engaged into the dentin while insertion and breaks the loose dentin during its withdrawal. Next would be the balanced force technique. This technique involves the oscillation of the instrument right and left with the different arcs in their either direction. So here the instrument is first inserted into the canal by moving it clockwise with 1/4 turn, then to cut the dentin, and the file is rotated counterclockwise simultaneously, pushing apically to prevent it from backing out of the canal. Then, finally, the file is removed by rotating the file clockwise simultaneously and pulling the instrument out of the canal. Now we'll see the watch winding motion. It is the back and forth oscillation of the endodontic instrument right and left as it advanced into the canal. The angle of the rotation here is the 30 to 60 degrees. So, next we'll see the basic principles of the canal preparation. In this, first and foremost, the canal should be having the straight line access to the canal orifice to establish the apical patency by passing the 10 number file. And the files always work with the canal along with the cupeous irrigation. Here the preparation of the canal should be completed with by retaining its original form and the shape, and the canal enlargement should be done in a sequential order without skipping the sizes. And all the working instruments should be confined within the root canal to avoid any procedural accidents. Now we'll see the important factors such as the anatomical considerations. Here the most critical area of canal disinfection is the apical 3 to 4 mm, which should be enlarged to facilitate the flow of the irrigants to the biological crucial apical third. Next we would see the pre-curving. In shaping a root canal, one should always pre-curve the stainless steel file blade before the instrumentation, and this procedure facilitates the insertion of the instruments to its working length and prevents the ledging of the canal walls. And this curve is prepared by grasping the blade and the gauge sponge, carefully bending the blade until the desired curvature is attained. And the next step would be the irrigation. So, irrespective of the instrumentation motion, frequent irrigation of the root canal facilitates the instrumentation and debrides the canal and helps to disinfect the canal. Ideally, 2 ml of the irrigant per canal per instrument change is clinically recommended. Now we'll see the restricting the instruments and the irrigants within the root canal space. Here the instruments and the irrigants should be confined to the root canal to prevent the trauma to the periradicular tissues. And the debris should not be forced through the apical foramen. So one must not force an instrument if it binds. Now we'll see the recapitulation. Here, returning to a smaller instruments from time to time before advancing to a larger size helps to prevent the packing of the dentin filings, ensuring the patency of the root canal throughout the apical foramen. So, removal of the dentinal debris from the used instruments should be always followed, as it will partly clogs the flutes of the instrument. So, this debris should be removed by squeezing the blade between the layers of the wet gauze and turning the instruments in a counterclockwise direction. Now we'll see the root canal shaping techniques. That includes the step back technique that has the conventional step back and the passive step back. Another one is the crown down, step down technique and its modifications. One is the crown down pressureless technique, double flare technique, balanced force technique and the hybrid technique. If you see the step back technique, here it involves the preparation of the apical third initially, followed by the middle and the coronal third of the canal using the larger instrument sizes. Here, the principal motion of the instrumentation occurs with the reaming motion and the apical instrumentation with the circumferential filing. And it has an advantage of able to prepare a proper apical stop prior to the apical preparation that is the middle third and the coronal third of the root canal. So we'll be creating a proper apical stop before middle and the coronal third. But the disadvantage is that it will extrude the debris into the periapikes, which may also tendency to straighten the canal, which may lose the working length also. And if you see what is the passive step back is that here it involves the use of the hand and rotary instruments to obtain an adequate coronal flare and the preparation of the apical part. So it provides the gradual enlargement of the root in the apical to the coronal direction without applying the force, thereby reducing the occurrence of the procedural errors. So next preparation is the ground down or the step down technique. Here it involves the preparation of the coronal 2/3 of the canal first, followed by the middle and the apical third of the canal. Here the principal motion is the reaming motion, and it is easy to shape, and it also eliminates the bulk of the tissue debris and the microorganisms from the coronal and middle third before the apical third, and also minimizes the debris extrusion. But the limitation is that it may create the gorging of the apical third it is the last phase of the procedure. And if you observe a modification in the crown down technique, in the crown down pressureless technique, the 35K file to the point of the canal binding should be done. Later on in the reaming motion, the GG drills with either number 2 or 3 should be used, which helps in coronal to the apical shaping with the K files up to the working length. Whereas in the case of the balanced force technique, the coronal enlargement with the GG drills with the number 2 and 3 and the middle to the apical shaping with the flexar files up to the working length using the balanced force technique is recommended. Next is the double flare technique. Here, the coronal to the apical shaping with the K files up to the working length, then the step back with the key files of the ascending sizes should be done to obtain the proper canal shape. And in case of the hybrid technique, it involves the combination of the ground down and the step back. And in this technique here, after achieving the patency with the 10 number file, the passive pressureless placement of the sequential sizes of the K files to the point of the canal binding should be done. And the coronal pre-enlargement with the GG drills in the sequence of the number 3 followed by the 2 and 1 should be done. And it should be properly established the working length with the 15 number K file. And then place the 14 number file and enlarge the working length from 15 to the recommended master apical file sizes. Then the canal preparation is done with the sequential use of progressively larger instruments placed successively short of the working length. So this step back procedure is performed until the middle third to the obtain a continuous tapering of the canal shape. Now we'll see the most important aspect in the canal shaping is the root canal working width. Here the surface of the root canal is irregular and interspersed with the recesses, crevices, fissures due to the result of the deposition of the secondary and the reparative dentin. So what constitutes the complete and the adequate root canal preparation is that how large and how wide the canal is. This is dictated by the anatomical structure and the accessibility of the canal. The traditional concept is that we used to enlarge the root canal at least 3 sizes beyond the size of the first instrument that binds, or enlarge the canal until it's clean and the wide dentinal shavings appear in the flutes of the instrument blade. Both these cannot be clinically recommended anymore. So the correct concept is that ideally minimum size to which a root canal should be enlarged cannot be standardized and varies from case to case. Here, the initial canal width, which has to be assessed both clinically and radiographically, and the canal of a narrow width, such as mandibular incisors, cannot be enlarged as much as the mandibular canines. And whether the root canal is vital, calcified, or infected should also be checked. And if even the radius of the canal curvature, which could make the shaping procedure more difficult. So the canal configuration with more attention to be given to a complex anatomies like C-shaped canal and the isthmus region. So canal shape with a greater taper, nickel titanium alloys, instruments allows the irrigations or the irrigants to reach the apical third more effectively. That's how the apical width should be maintained. So this is brief about the cleaning and shaping of the radicular space.